kids are coming with coprolalia, which is swearing, or in Tourette's disorder. We don't usually see that, so very uncommon. Also, many of the words they're saying, just like that one person, the comments, it's British terms. So I had one patient say beetroot, which is not a common thing that people say in the United States. And so it really does not fit with a typical picture of tic disorder diagnosis or Tourette disorder diagnosis. And a lot of them have anxiety on top of it too.
So, Dr. McVig, why is TikTok a culprit for all of this?
After I saw a few patients recently, I got a little savvy and started to talk about TikTok because I have children of my own, and I watch the videos myself, and you all feel compelled to do the movements as well. You know, I mean, it's human nature. We have these mirror neurons in our system that kind of mirror things, and so it's hard. So when you see the movements, you even in your brain want to shut it down, but you feel compelled to make the sound or do the movement. And so I try to relate to the kids and answer the questions that they have and communicate with them about their anxiety and how to work with them.
And Dr. McVig, if you could explain to us how the stress and isolation of the pandemic is clearly playing a role in this uptick in tics.
It's been tough. Our adolescent population has already been disconnected through social media, just because it purely exists. But then you put them in a room independently, take school away, or make school virtual, then they're much more apt to be online for hours on end at a time. And the hard part as a parent is you really can't control those situations. But parents need to delve into what are their kids watching, who are they connecting with, how are they searching things, and why are they searching these things out? It's very concerning. It's made kids very isolated, and this adolescent population is so vulnerable because they just want to connect and be heard and be loved and be with each other.
This whole thing about connection,
right,
and how the pandemic has been such a huge disconnect for all of us, but adolescents, younger people are particularly susceptible to that disconnect and how it affects them.
They really are, because their number one goal of adolescence is to connect with each other. We don't want to be different. We want to be the same. We want to belong to the thing. And what they're really, really good at? Two things: modeling behavior and attention-seeking behavior. And the pandemic shut a lot of that.
Getting the attention that you're speaking of. Yeah. And I'm curious, Dr. McVig, why are a lot of these TikTokers, tics, the tic videos, Tourette's videos, why are they females, young females?
Well, this is with mass psychogenic illness. What they've seen traditionally is that young women tend to be more prone to this. Some of the theories have been that women have this empathy or this compassion. There are theories about mirror genes and mirror neurons, where we see things and we put them into our bodies. And we emulate them. So a movement, a sound, and this has been studied predominantly in animals, but then we've kind of seen this progress into allowing us to understand how other people have these movements during mass psychogenic illness. Why females? I think women a lot of times too are prone to having to want to have that ability to fit in. And when you see someone suffering or struggling, it's almost like you want to help them or fix it or make it better. Not that boys and men don't have that propensity, but that's kind of what we're doing with the Libra case as well, and with history with mass psychogenic illness.
Wow, what an interesting and disturbing.
Right. And with the females, it could actually be almost 2 to 1. So that's a high number. That's prone.
Well, on that note, after the break, we'll talk to a young woman who says it hurts worse. Stick around. Coming up.
So, Alex, TikTok amplified your tics. Are you still using the app?
Then, popular celebrity diet is proving disastrous for babies. That's coming up.
Give your sensitive skin even more. New and improved Cetaphil is specially formulated with our dermatologist.
So Grand Rising. Thanks for tuning in. I hope everyone is doing great. Yes, indeed. I had to catch that. That is a very, very important topic. Okay, so TikTok is really a spell because what you're doing is mimicking someone else's behavior. Okay, and then once you mimic it, then you can't stop. It's a spell, people. It's a spell. Okay. Now,
Limitations for nonsense and inefficiency. I got well. They're pros at putting
we're
everything
going to
together
go back
to make things
to
easier. Include things like prescription drug coverage, dental, vision, and hearing coverage. It just makes sense.
Do you want a Medicare
because
Advantage
it's so
plan that
much
just
out
makes
there,
sense?
people.
Then be like Joe Montana and go with WellCare. Call for a free WellCare guide today.
And you're not even aware of what you're doing.
He's only days away. All thanks to attorney Dan Newland.
What's happening, Orlando?
People are being sacrificed and don't even know it.
Toby Keith, Trace Atkins, and Clay Walker are coming to you December 4th, all thanks to your good friend, attorney Dan Newland. We'll see you at the show, baby. Let's get it rocking, baby, all year.
Made in America.
I using all of that
Don't worry, Mom. There's
social media.
well, let's say if I'm the one who takes
You will only find me on YouTube,
always stays
on that Facebook, Instagram, and I've never been a fan of
and it helps me discover
TikTok
the
at all.
businesses.
This sounds wonderful. Come outside of the news. You're here.
Came back from the gym, and I caught this. Okay.
The pandemic has us all glued to our smartphones. But while this amplified social media use may appear harmless, could TikTok be causing kids to tick? Mental health professionals worldwide are documenting.
And I am a mental health
adolescents who are
professional,
picking up
clinical
Tourette's-like
social worker.
behavior from TikTok.
So, big question. Can using TikTok cause kids to tick? I mean, this is real. We're back with neurologist Dr. Jen McVig, and also we're bringing Alex into the conversation. So, Alex, welcome to the show. Tell us how the pandemic and your social media use amplified your tics and your condition.
My tics started a couple months into the pandemic in about June of 2020. It wasn't a great time of my life. I was super stressed. It was the most isolated I've ever been. And I just, like she said, I just kind of woke up one day with like a slight twitch in my lip. And then over like the course of like 2 to 3 weeks, I picked up a couple other like tics and other like motor tics of that sort. I would say that like in social media, like the most dressed, the most sensationalized. So if you have really severe tics like the beans or the beetroot ones that you saw on TikTok, like that's gonna probably get a lot of views. But mine were pretty minor. So kind of my contribution to the entire thing was I looked at, as a scientist, I looked at a lot of the publications going on in the literature at the time to try to see what was going on.
So, Dr. McVig, is what Alex experiencing similar to what you're noticing in your practice? You mentioned that you're definitely seeing more and more of this.
Absolutely. I think the interesting thing, the whole goal of TikTok is to imitate, right? So what we're doing is seeing a video or something that's being posted and trying to do the same thing or do it differently or put a different spin on it or do it better. So to go on there and try to imitate it, repost yourself is the whole goal of it. So as we individuals who have underlying history of tic disorder or Tourette disorder, it absolutely could exacerbate things. Or if someone just has that propensity to have underlying stressors in their lives and then have these motor symptoms come through a conversion disorder in a psychogenic illness event, this is a true concern. But it makes perfect sense that TikTok would be the vehicle because the whole point is imitation.
Yeah. Now, Alex, when you went to your psychiatrist with the tics, what did they do?
At first I was on antidepressants, so I was wondering if that might have been like the cause of it, because it was around one of the times that I switched antidepressants. So I went cold turkey. I went off antidepressants for like 3 months, and they persisted. My tics are still here. I switched medications a couple times, and it's been, I think, a year and 3 months now that I've had tics. So we kind of just went through and ruled out things, and we had to wait a year before we could like fit any diagnostic criteria for tic disorder.
Well, that's my next question to you, Dr. McVig. Why is it that it takes a year to diagnose a true tic disorder, and how to rule out or rule in mass psychogenic illness?
So, as I said, typically with a conversion disorder, which is one person, or mass psychogenic illness, which is multiple people, the events occur overnight. But with an organic disorder, such as tic disorder or Tourette disorder, this is something that is longstanding. Usually people have a hint that this has been going on for a long time, and it evolves. We try to make sure that we've ruled everything else out because it is a diagnosis of exclusion. But typically, as a neurologist or a psychiatrist, you can see that the motor symptoms are, they're actual prototypic or typical for that type of disorder, whereas the mass psychogenic illness or conversion disorder, a lot of these are not the exact same tic, which is very odd to have happened.
For a while, I took a couple months off of the app, just for personal reasons. I feel like it had a big effect on my mental health more than just tics. I'm back on it now just for like entertainment purposes, but I try to really limit my use of it.
Dr. McVig, this has to be really concerning to parents out there that are hearing this, that are seeing this evolve. Tell us, what advice do you have for them? What should they be doing?
I think one of the biggest things is to connect with your kids. We're all so disconnected. It's not just kids. We're on Zoom right now. We're all in this real world where we're at this altered reality of computers and phones. And so I feel like having those conversations, taking personal time with each of your kids independently, not like as a whole. I have 3 children, trying to find that private time, asking them, what are you viewing? What are you doing? What are you looking at? What bothers you? How are you feeling? What friends are you hanging out with? And actually taking their points in time, having a limit and going through their history and seeing what they did. My policy in my house, my device, my phone, until you move out of this house. Sorry. That I respect your privacy, but to an extent. I want to keep safe.
I mean, we've talked about this before. I know it sounds like a little bit of tough love, and kids are going to rebel when you watch them. But as parents, it's our job, and kids out there, you have to understand that they're just trying to do their job and what's best for you.
Exactly. It's not helicopter parenting at all. Adjustable.
Exactly.
As they're supposed to be, because they're
Well,
kids.
we reached out to TikTok for a comment, but they did not respond to our request. So
Yeah.
the saga continues.
Yeah.
Thank you so much, Dr. McVig and Alex. Thank you for joining us, sharing your story and the added research that you did on your own. And once again, Leslie, a
Fantastic job.
great investigation.
It's important stuff.
Very important stuff.
Yep.
Thank you, Leslie.
Thank you.
There's much more right after the break. Coming up, popular celebrity diet is proving disastrous for men. How makeup can clog the glands of the eyes. That's coming up.
Better skin from your body wash? Try Olay Body Wash with skincare super ingredient collagen. Olay Body Wash hydrates to improve skin 3 times better. From dry and dull to firm and radiant. With Olay Body, I feel fearless in my skin.
Nature's Way believes immune health is a gift, one that has inspired us for over 50 years. It's why we bring you Sambucus, made from premium elderberries for quality immune support. Your wellness is personal. Make your way with Nature's Way Sambucus.
Fairlife brings more to your holiday traditions. It's ultra filtered milk with 50% more protein.
Okay, I'm gonna end it right there.
And a creamy taste.
So yes,
This season, turn
so
delicious into delicious. Ultra filtered milk.
I wanted to share that. I wanted to share that with y'all. I'm a licensed clinical social worker myself, and that is very Let me get some light in here. That's very disturbing. Anytime you repeat a behavior of someone's, you're going to start doing that automatically. One is creating an illness. You have brought a spirit into you. That's just what that is. Okay, so y'all please like, share, and subscribe. Please hit that notification button so you'll be notified when I am dropping new videos. Shalom.